Hello and good evening, and welcome to this webinar about psychology careers in prisons. We're joined by three members of the North London Mental Health Partnership, and I will introduce them shortly. My name is Sarah Pinch, and I'm the Managing Director of Pinchpoint Communications. And it's been our absolute privilege to work not just with the three colleagues you're meeting this evening, but the whole team on this campaign about what it's like behind the prison walls. So I'm delighted to say that we're joined by Jarrod Cabourne, who is the lead for Therapies and the senior clinical psychologist, Sara Boulter, head of Therapies and a consultant clinical psychologist, and Natasha Sarkissian, who is the psychology lead for prisons and a consultant clinical psychologist. So thank you all so much for taking the time to be with us this evening. Just some housekeeping from me, which is we will try to answer all of the questions that you very kindly submitted in advance, and thank you so much for those. Please also feel free this evening to pop any additional questions in the Q&A function. We will be recording, in fact, we are recording this webinar, and we will be sharing that recording with you afterwards. Right, let's get started. Jarrod, I'll start with you. Why did you choose to work in forensics? And can you just give us a little bit of the career that you've had to date?
So good evening. Very much kind of warm welcome to everyone, and thanks for having us. So actually, I have been working in forensic services, so in the prison service for 10 years. In fact, in a few weeks, I think it'll be my 10-year anniversary working in prison services. I qualified 14 years ago, so worked 4 years before I came into working in forensic services. And I think looking at my journey kind of throughout those first 4 years before I came in and into the prison service, not that when I say it was inevitable I was going to end up in prison, it sounds a bit strange to say, but in some ways I could see my journey kind of building towards that. I think I've always had a passion for working with, I suppose, kind of people that kind of, I suppose, typically might be seen as marginalized, stigmatized, kind of part of the population that might have certain kind of health beliefs about them, kind of, I worked in kind of, assertive outreach teams, kind of community mental health teams, kind of working with quite complex trauma, kind of quite complex, long-standing difficulties. It felt like it was a matter of time before actually kind of my, I suppose, personal interest and kind of desire to kind of work in somewhere quite challenging, whereas I suppose really required to be quite creative with how you deliver and think about psychology. And I think that's kind of what then brought me into the prison services, where you have to really, I think, challenge some of the typical ways you might think about psychological interventions or just psychological thinking. You're having to kind of put this then into a system that isn't maybe built on those foundations. It's generally around kind of security, punishment to a degree, but kind of, this much more secure state rather than kind of care and compassion, which might traditionally come more easily to us as psychologists. So I think it was more about kind of that personal challenge that then kind of brought me to find my way into the prison service.
Thank you very much. And Sara, if I can ask you the same question.
Yeah, hi and welcome to everyone. I got into forensics by accident. I trained in South Africa and came over here, too many years ago to really mention, and was looking for a sort of part-time job just to get a feel for working in the UK. And there happened to be a locum post available covering someone's maternity leave. And I was like, yeah, I'll do anything actually, and took that post and really enjoyed it. And I think very similar to what Jarrod said about, working with people who are kind of marginalized and very much deprived, stigmatized, that kind of thing, that was, and working creatively and not in sort of traditional psychological models and that kind of thing. That was really what drew me to it. I really enjoyed it. I stayed, and 20 plus years later, I'm still here. I've worked in possibly, so our division covers prisons, but also covers liaison diversion and kind of specialist services, but also inpatients, community. And I think I've worked in every part of the service, and I'm now the head of the department.
Thanks, Sarah. And Tash, the same question to you, please.
Yeah, hi everybody. I suppose what interested me is pretty simple. It's just a really, I just wanted to have a really deep understanding of what drives people to behave in the way that they do, and to really understand all of the driving factors that lead to that, really. I remember when I was at school, I volunteered for a charity working with children from all sorts of underprivileged backgrounds. And I think that's sort of what led me to wanting to work with people who are, as Jarrod has said already, really marginalised and perhaps, haven't had the same opportunities as other people. And just really think about the interface between some of those more social factors and then, the other psychosocial ones, really. So I worked in lots of different settings as an assistant psychologist, but actually specialised quite early on in forensics. So when I was training at UCL, I requested some specialist assessment in forensics, and then when I qualified, I went straight into working in adolescent forensic inpatient environments, and then moved on to working in a young offenders institution. I helped to set up a community adolescent forensic service, and then eventually ended up in the adult prison estate where I am today.
Thank you very much. And I think your answers all illustrate the great variety of opportunities there are within your profession and indeed within forensics itself. Now, lots of people are nervous about working in prison, or in my case, coming to visit a prison. And, my experience was actually it was incredibly welcoming and I felt incredibly safe. Jarrod, can you just say a little bit about your day-to-day experience and how it feels to be working in that kind of secure environment?
Yeah, I mean, there's a reality, it's a prison. So I suppose, I think there is a reality to some parts of the environment and the context you're working in. There are higher levels of much higher kind of expressed emotion, and sometimes kind of difficult situations are happening. But I suppose most of the time, actually, because you are in a prison, it's, security and safety is really at the forefront of everyone's mind. So actually, almost on the converse of kind of what you might expect, it is an extremely kind of safe place to work, because I think the thing that everyone's always thinking about is making sure that yourself, your colleagues, the people you work with, your clients, your patients, other people that kind of live and work inside the prison estate are all kind of safe and kind of supported. So I think there is something, although it, as I say, it can be a difficult and challenging environment to be in, safety and support is always at the forefront of our minds. So we are very clear with everyone that we work with, kind of, as I said, kind of colleagues, about how we work in a safe and effective way. So yeah, I think there's something about holding into the reality, but actually the reality might be quite different to what people think, because we're all thinking so much about safety. So yeah.
Tash, have you got anything to add?
I was just thinking that, I probably have felt safer working in a prison than I have done in the past working in the community or working on the inpatient unit. As Jarrod said, safety and security are paramount to everybody. There are lots of policies and procedures in place, lots of hoops that you have to jump through as a therapist, to get something off the ground. If you're looking to start a new intervention, you have to cross-check everything with the prison. And we have, local policies in place that complement that, things like making sure you go to handovers, getting a debrief from the officers if you're going to take people off of the wing and into intervention group. These things are just sort of part and parcel of the everyday. And yes, there absolutely is a reality to the setting that you find yourself in. But there are so many processes and policies in place really to support you, and as a woman. There's no getting away from the fact that you are, you know, working. I've been working in male estates, so that's always something that we think about. We think about it in supervision. We think about it in reflective practice, and it's just part and parcel of everyday conversations with our teams as well.
And Sarah, if I can ask you, thinking back to when you were actually working in prison, what would be the thing that you would want your peers to know about the reality of that experience?
I think it's important, as both Jarrod and Tash have said, that you're aware of the environment that you're in. And that's paramount. But I think once you get beyond that, I think it's thinking about the people and being curious about the people that are there and understanding what it is that has happened that has got them to that point. And I think when you get to that, when you're able to do that, then there's just so many opportunities for you to work with the individual and make a difference in their lives. And I think that's really important to hold on to.
I think it's that humanization, isn't it? Sorry, Sarah. Just there's lots of dehumanizing of you know, people in prisons that happens. We see it all over the media as well. And I think if you've never been in a prison, you've never worked in a prison, of course, that's your only reference point, or, you know, what you see on TV. And actually, it's just, you know, there are people behind the numbers, and our role as psychologists or therapists more broadly is to really build those relationships and get to know people and what brought them there in the first place. And as Sarah said, I think once you get to that point, you start seeing people in that way.
It's making me think, actually, when I think about the work that we do, kind of when we think about kind of the clients and the kind of the patients, the clients that we work with. Actually, I think I may have said this kind of in one of our kind of other conversations. I always see kind of like my first and kind of primary patient or client are the prison walls. It's the establishment, it's the system that you're in. It's, you know, they're often kind of very old kind of Victorian buildings that have a culture and a kind of a history to them, and their own ways of being and doing. And I think part of it is excitement. I think part of the enjoyment, the excitement, the curiosity that you have about working in such environments is thinking about how people who then kind of live in prison or kind of residing there for a period of time, how they interact with the environment, how the environment kind of impacts on them. So it's being aware of the environment you're in, but also the impact of it on the individuals you're working with, and remaining curious to that.
And some people in prison will have done things that are really difficult and may result in a kind of very understandable human reaction of, how do I care for this person who's done this thing? Would one of you just talk about that a little bit and how you approach that? Tash, let me start with you.
Yeah, sure. I think it's really important to acknowledge that, actually. We are trained, we're very well trained, but we are also human. And I think what affects me might be different to what affects Jarrod, to what affects Sarah. You know, we're all unique, so we're affected by different things. But I think, you know, this is why teams are really important. We work in MDTs. We try and work really closely with our colleagues, not just from psychology, but also nursing, psychiatry, other therapists, and our prison colleagues. Supervision is incredibly important. You know, as a trust, we really value it. We offer reflective practice to our teams, as well as like another opportunity to really think about complex cases. But also, I think, you know, looking after ourselves and thinking about our well-being, you know, and as a manager, it's thinking about your team's well-being and what things are in place really to support people, and are there enough opportunities for conversations, both formally and informally, to really think about the impact of the work and just normalise the fact that the work will have an impact, and just to make it okay for people to name that.
And an MDT, we should say, in case people don't know, is a multidisciplinary team, isn't it? It's the coming together of kind of every single person involved in the care of that individual to talk about their care. Yeah. And day to day, Jarrod, when you're in prison, what does your average? Well, I think the answer is there is no average day, but day to day, what does your day look like?
Yeah, I mean, I think, again, it's probably one of the things that has kept me working in prisons for so long, because I think there is a huge amount of variety to the work you can be doing. There's, even when I say kind of there's the more the standard bits of work you do, you know, kind of your interventions, kind of, you know, doing assessments, providing one-to-one or group interventions, even that you have to think very creatively about how you're doing that in a prison system and kind of what your goals are, having to really kind of rethink and reshape what recovery means, what people want to be getting out of therapy. But your day-to-day definitely kind of does incorporate some of that kind of, you know, your traditional kind of, you know, assessments and providing kind of interventions. But then I suppose broaden kind of out of that, as I was saying before, about kind of, I often see kind of one of my main kind of clients that is the prison and the system itself. There's a huge amount of, I suppose, opportunity to work with other people in the system, whether that's other people in your kind of, you know, your multidisciplinary team, other healthcare professionals. But what I think is really interesting and exciting is then working with people from kind of non-healthcare kind of professions. So that's working with the operational staff, you know, governors, safer custody, officers on the wings that I suppose are kind of there day in, day out, kind of, you know, in long shifts working with kind of the men that are kind of residing in prison. And I think that's where a large part of the work really challenges you to think about how you support others to support then the people living in prison. A lot of work around kind of, understanding kind of communication, what brings out behavior that challenges, how you can kind of support the system to support someone whilst they're residing in prison, but also, I suppose, thinking into the future, how we can prepare this person to be in the best position to maybe step down into a kind of a low secure estate, or to be released back kind of into the community, kind of back to kind of, you know, maybe kind of family, maybe kind of to different living situations. So there's also something about kind of thinking ahead as well. And I think with that comes lots of consultation to teams and thinking with teams about that work. But the bit that always, I think, strikes me is it's probably one of the challenges, but it's one of the bits you have to hold on to, kind of the hope that some of that work you don't then get to see the output. You know, you're doing kind of work hoping that, you know, kind of with the expectation that when the person is then released into the community, this work will really then sometimes take hold. But sometimes you don't get to see that in the day, kind of the day to day. So there's something about, I think my day-to-day role is about working with your team to kind of maintain your sense of hope. You're kind of working with small changes sometimes, although actually, when I say small changes, actually, I've definitely worked with people across the 10 years, and my team continue to do so, where you see life changes, you know, life-changing experiences for people. But sometimes you are working with small changes and really kind of holding in kind of the sense of hope with that as well.
Thank you. Tash, do you want to add anything to that?
Yeah, I was just reflecting actually that way back when I first started working in prisons, often, you know, I was the lone psychologist, trying to do bits and bobs here and there. And when I think about how much the role of a psychologist in prison has changed, you know, over the past 20 years, whatever it is, it's just incredible how far it's come. You know, we are lucky enough that across all of our services in prisons, we're so well resourced now. We don't just have psychologists, we've got occupational therapists, speech and language therapists, psychotherapists, and we're so lucky to have that now. And, you know, we get to work with such a huge variety of people that, yes, you know, you're in a forensic setting, but, you know, you're working with older adults, you're working with young adults, you work with neurodivergents, people with learning disability, you know, the list is almost endless. So the day-to-day is so variable, it's very hard to describe, I think.
Thank you both. I think that's given a good insight, though, into that great variability that there is, an opportunity that presents. And so, Sarah, if I could ask you, you obviously have worked in prison, as you say, you now are head of the service. What opportunities are there for career progression, would you say, within the prison service? If someone was thinking that they might like it, but thinking that might not be a long-term commitment for them?
So I think as Tash and Jarrod have said, and in talking about their own career progression within the prison, we have roles within the prison from our most junior assistant psychologists up to more senior consultant psychologists. So there is that progression within the prison, but also I think it's important to say that with the BEH prisons sit within a much bigger division, which as I said before, has hospital and inpatient psychologists. We have community psychologists, and we have, within our division, we also have substance misuse. So there are lots of different opportunities for people, and not only that, we're within a much bigger trust, so that there are opportunities there as well. But I guess within our division, there might be opportunities to do secondments in different areas so that people can get experience before committing to moving into a different area. So I think there are plenty of opportunities.
And there's also a lot of training and support and commitment to personal development for colleagues, isn't there?
Yes, yeah. We certainly see the importance of that kind of developing our staff and supporting our staff, because that's how we if we invest in our staff, then they're more likely to stay with us. And also our service users and our patients are going to benefit if we've invested in staff. And over the past year or so, we've had staff train in EMDR, we've had training on compassion-focused therapy, we've had training around neurodivergence and ADOS, which is, I don't know what that exactly stands for, but it's assessments for autism. Tash, you might know exactly, but I don't know what it stands for exactly. But trauma-informed training, there's a whole kind of raft of training available to people.
Thank you. And Tash, just thinking about those people that have joined us this evening that are students, what is the best way for them to get work experience in this field?
So I think the usual route would probably be to try and get an assistant psychologist position, but obviously I think we're all really aware that they're really, really competitive, and I'll be honest to say that when we do advertise an assistant psychology post, we do get lots and lots of applications. But also in prisons, we now have mental health practitioner posts. So, and actually the overlap between that role and an assistant psychology role, there is quite a lot of overlap with that. But also I would think outside the box. So I would say that it isn't necessarily about the setting that you're in. So if you're interested in working in prisons, it might not be, if you can't get an assistant psychology job, it might just be around exposing yourself to similar presentations, try and get a job working with people with complex mental health difficulties, for example, or even substance misuse, because there is significant overlap with that. So I would say, AP, mental health practitioner, or expose yourself to similar presentations. It isn't just about the setting, really.
Thank you. And I know, Sarah, that you've got a number of opportunities at the moment in your team to speak to Tasha's point about getting experience in similar areas. There definitely is that opportunity across, not just within BEH, but also across the North London Mental Health Partnership, isn't there?
Yeah, so certainly the North London Mental Health Partnership is enormous because it covers both Camden, Islington, and Barnet, Enfield, and Haringey, and there's a range of different roles available there. But specifically within forensics, we have a number of roles for both qualified and unqualified. As in psychology assistants, so you will have a psychology degree, but haven't gone on to do a further training. Yeah.
Thank you. Jarrod, if I can ask you, what would you say is one of the most challenging aspects of your role?
It probably links to what I was talking about before. So although it's going to be a true psychologist answer here, which is a real kind of multiple perspectives. But it's probably the thing that the most challenging is probably the thing that I enjoy the most, that you're trying to embed, I suppose, values of compassion, understanding, kind of all the things that we do as psychologists into a system that's not necessarily built to really think about that. And I suppose there's so many parts of the system working in prisons where you're having to work with limited resources, working way, things, I suppose, if you think of yourself as a psychologist that might be working with someone who's presenting with kind of low mood, kind of the things that you might typically do and kind of to support someone presenting with depression, low mood, to then work with a person that's presenting with those difficulties within a prison environment where they might be inside a cell for a large part of the day, limited opportunities to have contact with their kind of usual support networks, or if they do, those are limited to particular times. Sense of autonomy and control of your life is kind of stripped away a bit, and down to the times at which you're kind of almost going to sleep, to the times you have your food and kind of meals prepared. So all of a sudden you're having to think, how would I typically do this kind of work in the community where someone has a huge amount of autonomy in their life and sense of agency? I now need to bring that kind of into the prison. And it still always makes me remember a time when I found on the wing someone had tried to be really helpful and put up a poster, 10 ways to help if you're suffering with depression. And there were things on there kind of, have a bath, light a candle, go for a walk in the garden. And probably I would say about 8 out of these 10 top tips for managing low mood, if I was someone living in prison, I'd have found that extremely offensive. It would have probably made me quite frustrated. So it's really, that's, I think, probably the biggest challenge. You're having to take kind of lots of these traditional methods and kind of models that you've kind of trained in, and then think, okay, now let's put these in a system that can be highly traumatizing and re-traumatizing. Mm-hmm. And how do we support someone in this very difficult environment as well?
It reminds me of very early on in my career, somebody explained to me that working in a prison is a bit like, you're a guest in somebody else's house. And that's really just sort of stuck with me, that actually you have to do all of those things that, Jarrod has just spoken about to get to the same end point. And it's just always that's a challenge, that you have to be creative and find ways to do things. And I think it's very much about nurturing relationships with key people in the estate. So key governors, key senior members of staff, building that rapport with them because they're an integral part of the system. As Jarrod said earlier, they're your first client, they're your first priority. And without those relationships, other things then become quite difficult.
It makes you kind of, so I was just thinking, it makes you every contact that you have with a client, I often try and think of it, and I probably don't think of that this consciously anymore. I think it's just part of kind of your unconscious kind of processing as a psychologist or as any kind of health practitioner in prison. But there are so many other parts of the puzzle that could be moving. People do get transferred and they move on, sometimes with very little notice. And if you're doing a piece of work with someone, you always have to hold in mind a bit of a kind of a longer term plan of the piece of work. But also there's this 5% that you're working on. Well, actually, if all of a sudden there was something to happen where this person needs to transfer or they move, how do we make sure this person still has a containing, good enough experience of therapy and attachment and connection with someone that doesn't just replicate probably what they've experienced throughout their life, the difficult attachments, kind of a sense of we'll just move you wherever, it doesn't really matter. It's trying to work against what can be quite traumatizing and kind of, a system that just replicates kind of difficulties. So you have to hold that in mind as well. I think is another part of the difficulty and challenge.
It's a bit like sowing the seed for the future, isn't it? And I think if you're thinking of coming to work in a prison, you probably need to be okay with that and be okay with the idea that you might not, you think you're doing an amazing piece of work, but that you don't get to finish it. And that can be hugely frustrating, and you won't really ever know what happened to this individual because they've moved off. And I think there needs to be some level of acceptance that actually I may have sown the seed for this person. I've given them a positive experience. I've changed their relationship to help, which may make it more likely that in the future they're more likely to ask for help. And I think let's not underestimate the power of that, because often we're working with people who haven't asked for help, and that's very stigmatizing for them. So actually, if you can move that person into a position of thinking, actually, this person came to see me in my other prison, they weren't so bad, it was kind of helpful, I'll try that again. That's hugely positive, I think.
And is there ever an opportunity, Tash, for someone to volunteer within the prison service at all?
So with us, we don't have volunteers, and that's largely because of safety, security, governance, supervision arrangements, those sorts of things, and also space in our prisons. But the prison service more broadly does have volunteers. So for anybody who's interested, I would probably advise them to get in touch with the PACT service. So every prison will have a PACT service. They're the people who run the visit centres and liaise with families and carers. And I know that there are volunteering opportunities there. I think it's pretty easy. You can just Google and you can find the contact details.
Thank you. And Sara, somebody asked us whether you needed or whether you need to have attended therapy yourself before you could practice as a psychologist.
I think different courses have different requirements, and not all of them require people to have had therapy themselves on the course. The course that I did require therapy, and I found it really invaluable. I think the courses are not easy themselves, so just having that support at that particular time was really good for me. But also I think having the experience of what it feels like to be on the other side of therapy was really important. And I often think about that, particularly if it feels like something's not quite gelling, or I feel a bit stuck with a particular client or service user, and I kind of take a step back and think about myself in that position. So I don't. There's nothing that says, as a psychologist, you have to have had therapy. But I certainly think it's, for me, it was invaluable.
And Tash, I think all of you have mentioned reflective practice. Could you just say a little bit more about what that is?
Yeah, sure. So we offer reflective practice spaces to our colleagues in the prisons. That is essentially a safe space that's facilitated and is either facilitated by one of our psychologists or somebody else from the mental health team, but we also buy in some input from the Tavistock Clinic to offer all of the staff reflective practice. And it's essentially a safe space where people can come together and really think about the impact that the work has on them, and it's used differently by different teams, and and facilitators are very open to that. Sometimes it's to really think about complex cases, do a bit of formulating maybe, try and help each other understand why an individual might be presenting in a certain way, think about how to move forward. Other times it might be used to debrief or understand a particular incident that may have happened. And other times it's more focused on the team, maybe team dynamics or things that aren't working very well. So it really very much depends. But in general terms, it's a safe, facilitated space to think about the impact of the work.
And Jarrod, I imagine that is something that helps you deal with elements of stress or burnout or frustration that you might be feeling in your work.
Yeah, I think, as much as the work that we do is important, kind of alongside that, kind of self-care is a huge priority. I mean, as a psychologist working in any field, but I think particularly in a prison and the environments that you spend then essentially a large part of your week in, if you're kind of working full time, making sure that you have good boundaries set in place as well, I think is important. One thing that I definitely notice that can come up for people often kind of in the start of their careers in prisons is you become very aware very quickly of the high levels of deprivation and need that is in the clients and the prison systems that we work in. And I think sometimes that can kind of get into you a little bit. And then there's almost this sense of if you take that annual leave or, of the Christmas break or bank holidays or weekends, something doesn't sit comfortably, that you're leaving at the end of the day and you're living this sense of need and deprivation in these walls of this prison. And there's something about using, as Natasha was saying, reflective practice to help understand and help us kind of, I suppose, process that and understand our roles as psychologists. And actually, it is important that we take our time, that we kind of find ways to, I suppose, kind of look after ourselves, make sure we keep our boundaries, make sure we do take our regular leave. We lean on our client, on our kind of colleagues. We have a real kind of, I suppose, a team kind of offensive team where you really kind of lean on each other for that support as well, and you have your kind of regular supervision. But there's something about kind of finding your own kind of self-care kind of practices that work for you. I know kind of, people do lots of different things, self-care. I was never a big fan of mindfulness myself many years ago, probably a bit of a convert now, I would say. It's definitely a helpful way just to kind of manage what can be can feel sometimes a bit of a chaotic kind of environment, to kind of just make sure you have those moments kind of throughout the day or throughout the week where you just kind of pause and just kind of reconnect again with kind of the work that you're doing.
And someone's asked a question, Tash, about recruitment, and is it all year round, or do you have jobs available at certain times of the year? When should people look out for opportunities?
All the time. We advertise roles as they become vacant. So if we're thinking of things like assistant psychology roles, I would say probably that the summer is a good time to look, as they are offered places on training courses. They will naturally move on. So the summer can be quite good for those sorts of roles. Otherwise, it's any time, essentially.
And someone's asked a kind of related question about, are there routes into forensic services that don't require master's or postgraduate level study?
I would say probably not, other than, the post that we've already talked about in terms of assistant psychology roles, and also the slightly more generic mental health practitioner roles, which you can, get into with an undergraduate degree. And if
you started in one of those roles, there's nothing to stop you doing your additional study and then moving into a newer. Yes, absolutely. Yeah. Sarah, did you want to?
I was just going to say that that's specific to psychology, but you could also work within the nursing team in a sort of healthcare assistant role, and a lot of people do start off as a healthcare assistant and then move into an assistant psychology post, a bit like Tash was saying earlier about getting different experience and thinking a bit a bit more broadly about it, you know, getting that experience of being on the wards, working with this client group, and then that might then help get into an assistant psychology post.
Thank you. And Jarrod, I think we've talked about this, but I wonder if I could ask you a question about remaining hopeful. So you've talked about kind of leaving the prison and perhaps feeling a sense of responsibility that you should still be there. But when you're working with quite challenging or in quite challenging situations, how do you remain hopeful?
I think it is being able to lean into small change sometimes, and recognizing, and really, it goes back to what I said right at the start, kind of really honoring kind of when you're working with someone, you might have lots of messages from whoever's referred them. Sometimes the person might always refer themselves, whether it's probation or whether it's kind of someone else in the system, but then really honoring kind of our values about kind of, you know, individual kind of respect, compassion for the person, how they themselves think about recovery, what their goals are that they want to work on. Sometimes doing a bit of work around those goals, kind of breaking those down, kind of bringing them back a little bit sometimes, but really kind of working on that and recognizing small change that might sometimes be not even noticed. I think the thing that always sticks in my mind when I work with kind of the chaps that we do kind of in the prison is how dominant narratives can be about someone once they're in prison. Even just by the name, you know, kind of they're a prisoner, kind of almost kind of they lose their humanity. And I think this narrative of you're now a prisoner, you're in, but you kind of lose a sense of, well, what else have you done in your life? Kind of who else are you? What are your interests? And starting to bring back some of that and thicken up the other kind of parts of them and their kind of their story and their life and their kind of character is important, because what you can sometimes find is even when you start to make small changes, the system is so ready to miss those changes and just think, well, it's just a one-off, you know, kind of they're still XYZ. You have the hope comes from sticking with someone and that kind of perseverance with the small changes, building it up kind of over time, as Tash was saying, kind of thinking kind of what will this set this person up better for in the future if they've had an experience now of talking with someone that's felt quite different for them, that has allowed them to speak about some of the, as we've said, you know, some of the most kind of deepest, darkest things that they probably, you know, they've either kind of done or their thoughts in their mind they've had. Someone's been able to take that time with them. That sets them up in the future to reach out for help again. That for me kind of feels kind of really important. And yeah, it is that kind of sense of, you know, therapy and working with a psychologist. It's not just well, you make the decision to work with a psychologist and then you have therapy. Sometimes it's a bit of a dipping the toe in the pool for some people. They see what it's like and then they go, do you know what? I'll come back to this when I feel a bit more kind of in a better place to do it. And that's okay. It's about acknowledging and accepting, yeah, it might not be the thing that you want right now. That's okay.
Thank you. Tash, do you want to add anything to that?
I was just thinking about when I worked with young people, we would often have conversations with them around, you know, this isn't your life. This isn't the entirety of your life. This is a moment in time. Think about this as potentially, you know, a blip in your timeline, but it doesn't have to define you. It doesn't have to be the whole of your identity. You still have a future. There are opportunities. You can, you know, there's still time. And I think for me, often, you know, because the reality is we do get some revolving door clients who unfortunately are sort of in and out. And I think it's important to name that can feel quite frustrating and can sometimes get to you. You just think, gosh, you know, what can I do here to really support this person? How can I get this person to a point where they don't come back here? And in those times, I think I always remind myself of that and just how applicable it is to anybody in prison, regardless of their age, that actually this doesn't have to define you. And part of our role is to support people to share in our hope, because I think, you know, we always hold hope for people. And I see part of my job is in being able to support somebody else to get on that page with me. And that can look like lots of different things. It doesn't necessarily look like, you know, somebody engaging in 20 sessions of psychology for depression or whatever it is. That can look like somebody getting up in the morning and having a shower. I just think it's, yeah, as a psychologist, it's really important to think about what's meaningful for that person, rather than, you have a wonderful formulation, an idea of what you might like to deliver as an intervention, but actually, if that's not what's important right there and then for that person, it's meaningless. So it's just holding hope for that person, sharing that hope, and meeting them where they're at in their journey.
Thank you.
I was just going to add and say that really resonates for me. And a while back, I did I was on a training course around recovery, and there was a service user there who said, that they had been really depressed and couldn't see any, it had no hope in anything, couldn't see any future for themselves. And what made a difference for them was someone just coming and talking to them and about kind of what motivated them. So it wasn't about going to therapy. It was like, what's going to get you up in the morning and have that shower. And it's noticing those things and being curious about those things, which then, and as both Jarrod and Tasha said, you may be the person that asked that question about getting them up in the morning, and it may not go beyond that, but that experience might then mean that the next time they meet someone, they can take it the next step.
Thank you. And Sara, a couple of people have asked this question. Would you be open to considering hiring clinical associate psychologists or only HCPC registered practitioner psychologists?
So I think for our kind of qualified psychology roles, it would be the registered practitioner psychologists. We within the forensic service haven't at this point got CAP roles, but certainly within the partnership, there are some CAP roles. One of the things that we've been looking at is the CAP training is specific to specific groups, and at the moment there isn't a forensic one, as I understand it, but there is talk about that being developed. So at the moment there aren't those specific roles within the forensic and prison service, but that doesn't mean that there won't be in the future.
Thank you. And Tash, how many years experience would you say someone would need to apply to be an assistant psychologist?
I would say we don't really measure it in terms of length of time. So it's more about what have people been doing in that time. And we look for breadth of experience. And obviously it's great if people have worked as assistant psychologists before. It's great if they've worked in forensic settings before, but we look at everything. There's value in everything, isn't there? There's lots of transferable skills. So it's more about the range of services that people have worked in rather than how long, I would say. And
I think also what you're saying there is, apply and don't sort of self-limit. Yeah.
Yeah, absolutely. And, we put our contact details on all of the adverts. There'll be an email address that you can, if you're concerned or you're not sure whether it's worth submitting an application, just email us and we'll get in touch.
Thank you. And I think I know the answer to this, but I'll ask it because someone's asked it of us. Do you offer visa sponsorship for people to join you?
We do. We currently have one of our assistant psychologists on a visa sponsorship, actually. But one of the prerequisites, I don't think we've covered this, in order to work in a prison, you have to go through a really vigorous vetting process, which can take some time. It's a security check, essentially, that looks at your DBS and other things. And in order to get through that process, you need to have a national insurance number. So as long as you have an NI number, it's fine. And yes, we'll consider visa sponsorships. Yeah. And
whilst we're talking about people who perhaps come from more diverse backgrounds. I think it's important that we recognise that whilst we are for white people on this call, certainly my experience of running the webinars that we've done on speech and language therapy and on nursing is your team is very diverse in many different aspects. And certainly the time that I spent with the team in prison, I met people of very different backgrounds and experiences, race, genders, sexuality, and so forth. I just wanted to acknowledge that this evening, that we haven't been able to reflect that in this professional conversation, which is disappointing to all of us, I think, but there is great diversity within the broader forensic service.
Absolutely. I wonder if, Sarah, did you want to mention the Aspire programme here?
Yeah, that's exactly my next question.
I'm sorry.
Sorry, Sarah. No, that's fine. Yeah, within BEH we have this program called Aspire, which is really trying to support diversity within the workforce, and looking particularly at psychology assistants and what support we can do to get to support psychology assistants getting experience and then moving on to training from kind of diverse backgrounds.
Thank you. And you mentioned earlier, Sarah, that there were broader roles available across the partnership. And I just mentioned then that we ran a webinar on speech and language therapy and one on nursing. Can you just say a little bit more about the breadth of roles that are available across the partnership? Yeah.
So as I said earlier, our division is very large, and we have 12 wards outside of the prison environment. We have teams in the community. These are all forensic teams in the community. We have community substance misuse teams as well, and we have a number of roles for psychologists within those settings. But more broadly across the partnership, we cover everything from kind of neonatal to older adults and everything in between. We have services in learning disabilities. We have women's within forensics. We have a women's ward, but also services more broadly. We have working services in CAMS, which is child and adolescent mental health. So there are a broad range of services.
I think we could probably say, no matter what particular profession you're in or what particular area of mental health you're interested in, you could probably find a job within the partnership that would satisfy both of those things. And just to be clear, when we're talking about inpatient services, we mean patients that are on the wards, and when we're talking about the prison, we're talking about people who are within the prison community. Somebody was just asking for clarification on that. So I am aware of the time. We haven't got long. I wondered if there was anything that any of you wanted to talk about this evening that you've not had the opportunity to do so. Jarrod, was there anything you wanted to draw out?
Yeah, I suppose I'm just thinking a lot of what we've spoken about here, I suppose kind of myself, Tash and Sarah, kind of clinical psychologists as opposed to forensic psychologists. And I think it's probably important to acknowledge that we're talking about something slightly different in terms of the work that I suppose kind of we're involved in. Although there's a huge overlap between clinical and forensic psychology, our training as clinical psychologists working in forensic settings, I suppose primarily our work is focused on, I suppose, kind of, mental health and well-being and enhancing kind of someone's mental health and well-being, whilst holding in mind, I suppose, kind of offending behaviour and understanding the overlap with then offending with mental health. as opposed to, I suppose, a forensic psychologist where training is slightly different, focusing much more on kind of models of offence and kind of offending behaviour, a lot more around kind of risk assessment, of kind of predicting kind of future risk of reoffending. So although there's a huge overlap, I just thought it was probably important to acknowledge, I suppose, I'm very much talking from the perspective as a clinical psychologist working in forensic settings and thinking about kind of forensic populations, as opposed to being a forensic psychologist itself.
And I think that's another nod, I suppose, to how things have changed, because historically it would be, you know, forensic psychologists that are employed by the prison service, and then clinical psychologists are employed by the NHS Trust to work in prisons. But actually now, as BEH, we have employed clinical psychologists, forensic psychologists, counselling psychologists, and also psychotherapists in all of our qualified psychology positions. And that really is a huge change, I think. And again, we, the three of us, don't represent that because we are all clinical psychologists. But it's not just clinical psychologists that we.
Well, I think it's a further illustration of the great variety of roles and opportunities that are within forensics, but also, you know, more broadly across the partnership. Sara, was there anything you wanted to say this evening that you've not had the chance to yet?
Not in particular. I just really wanted to, I suppose, emphasize, and I think Jarrod started right at the very beginning talking about why he chose to work in this field, as describing really succinctly the kind of group of people that we're working with, and what it is and what it means to work with that group of people, and thinking about, you know, the holding the hope, the kind of small change that you can make, and actually the impact that has on you as an individual to see those small changes. So yeah, I just wanted to kind of re-emphasize that.
Thank you. And a very particular question, Tash, if I may, about someone asking, can you train as a clinical psychologist with a forensic MSc?
Yes. Yeah.
Excellent.
Absolutely.
And a final one for you, Sara. Where would people look for roles across the partnership? Where would they look to find the opportunities that are available?
So all of our roles are posted on a website called TRAC. I'm sure people are aware of that. It's TRAC. And all the NHS roles will be advertised there, and it's great because you can put in what you're interested in and the area that you're interested in, and you can get alerts sent to you when jobs become available.
Brilliant. And my final question, if I may, to each of you is, what advice would you give to someone who's been with us this evening who wants to work in prison? What would you say to them? Jarrod, I'll come to you first.
I'd probably say keep thinking about it. It's an interesting place to work, and I think as Tash was saying, that to get into this field, you don't just need to kind of get experience working in prisons. Think broadly about kind of the client group, the type of work that we're doing, what your own passion is. I always say it isn't for everyone. If you do consider yourself, you need to be quite resilient. You need to be aware that, it doesn't always work out the way that you'd want. It's not about, if you want to be a therapist that works, every week, bums on seat therapy from start to finish, nice and neatly packaged up, prison probably isn't the place for you. It sometimes is a bit bitty, and you have to be creative and kind of, shift things at the last minute. So that's the advice I would give. If that fits the type of person you are, it sounds like it could be a good option.
Thank you. Tash?
Yeah, I echo everything that Jarrod's already said, and just stay curious, be in touch with people, try and, come into a prison, have a look, see what you think. It's not as scary as people will make you think, and just try and get a range of experience.
Thank you. Sara?
Yeah, I echo what everyone else has said. I think getting that experience and thinking about transferable skills and different experiences with different client groups, and yeah, get in touch with us as well.
And I think we are giving some consideration as to whether we can hold some taster sessions. So we will make sure that if we do decide to do that, we share that widely. Thank you very much to the 3 colleagues that have joined us this evening. I've really enjoyed the conversation, and I always think I've learned quite a lot since we've been working together, but I've learned even more this evening. So thank you so much. We're just putting up there some information about where you can find additional information. And as I say, we have recorded this webinar and we will be sharing that afterwards, along with more information about where you can find out more. So thank you everyone so much for joining us this evening. I think at one point we had over 125 people, so that's really encouraging. And I do hope that, as the 3 of you have said, that people remain curious, understand that they can bring hope to people. And I think we said we wanted to lift the walls of the prison, and I think the 3 of you have been able to do that this evening really, really brilliantly. So thank you everyone so much, and good evening.